This is a case of TAPP inguinal hernia repair. This is done in IMSBHU by Dr. M.K. Yadav from Sankatmochan hospital. So you can see we have raised the flap as we regularly do in TAPP. Now we are dissecting on the right side inguinal hernia. You can see we have gone very deep inside the medial side. You can see visualize the white house, and this white house nearby it you can see the fine vessels. These are the corona montes. So we are widening the space on the medial side. Below you can see the bladder. So very clear you can see the bluish hue, that is blue color vein, that is nothing but a external iliac vein. And this, now we are coming to the lateral side, preserving the nerve, and this you can see the sac is being dissected, and cord structure and vas are taken care. So we are moving in a clockwise direction in upward toward the apex of the sac, and slowly we will dissect the area and move the vas away. Paratalize the vas. See, we have created a good space, and this is the